Dr. Patino here at the Cosmetic Surgical Center of Cerrito. So what we're doing now is we're doing an extended abdominoplasty. Look at that, huh? This is incredible how we do these at the Cosmetic Surgical Center of Cerrito without a single drop of blood. Here, following that line that we marked over here, all the way back here. It's just incredible, right? And now we're gonna follow it up with electrocautery. But this is a very special technique, you guys. You see any bleeding in there?
No bleeding.
Wow, look at that. So this is, I would say, it's almost a unique technique, Gabby, right?
Right.
If you want to have your tummy tuck like this in a completely bloodless manner like that, look at that. Just give us a call. This is really unique. And it's something that is a combination of things. It's not just one thing. But you can see that our patients, so this is her belly button right there, and we're gonna go down. Yeah, I gotta straighten that out, huh, Gabby?
Yeah.
There is some rolls here that we're going through, and this right here point out the prior surgery, Gabby, right there, yeah. And so now what we're doing basically, so blood vessel right here, so I electrocoagulate it. In other words, I burn it with this instrument. This instrument is called an electrocoagulator, and every surgeon has it. It's no mystery. So a lot of people think that this is a laser. No, this is not a laser. This is just a regular electrocoagulator, right? It's a little blood vessel there, and we just burn it and go through it so that there is absolutely no bleeding. But the key here is just a special technique. This is the way how I operate. I think it's a very unique technique where we operate, and as you can see before your eyes, there's absolutely no. And the lack of bleeding is a combination of things. It's things that the patient does. Also, we tell the patient not to take any aspirin or ibuprofen or herb-like medications, right? Okay. Tiny belly button, Gabby. Tiny and nice and cute, right? We're gonna go around that belly button. And this again is burning the skin, so obviously we're going to go ahead and we're gonna put some refresh the borders. In other words, we're gonna use a knife to refresh the borders of the umbilicus, right? But notice the complete absence of bleeding when we do this here at the Cosmetic Surgical Center of Cerrito. Thank you. Okay, so wow, look at this, huh? So bloodless abdominoplasty right here at the Cosmetic Surgical Center of Cerrito. This is just incredible, and we're gonna go ahead and follow it up with electrocautery, right, Gabby?
Right.
So look at this. So what we do here is just amazing. Look, do you see any bleeding there?
No.
Can you see that?
No bleeding.
What do you see?
Yellow fat.
Yellow, beautiful fat. Give us a call. Thank you. Wow, so look at this. This is the left side, right, Gabby?
Right.
And look at that. Absolutely no bleeding here at the Cosmetic Surgical Center of Cerrito. Thank you.
This is the specimen on the right side. No bleeding. Thank you.
So now we're going to show you how we do the drains also in a completely bloodless manner here at the Cosmetic Surgical Center of Cerrito. Everything is bloodless, So I like bloodless surgery. Bloodless surgery has incredible advantages. Thank you. Okay, so what are we doing now, Gabby?
Making a new home for the belly button.
A new home for the belly button. So I'm cutting with a knife. This is a number 15 blade for those doctors watching out there, and I'm making a rhomboid or a diamond shape incision, right? But notice the complete absence of bleeding. And another thing that I do here, even to make it, this is not necessary, obviously, this is something that nobody does, but I came up with this because it's a simple thing, it's de-epithelialization of this area. And what it does is it just makes it bloodless, right? So we don't like blood. So bloodless surgery, like I said, not only has the advantage of that there is no anemia, right? And when there is no anemia postoperatively, then there is no fatigue. When there is no fatigue, then the patient is going to be walking. When the patient is going to be walking, the patient is going to prevent a blood. Yeah, and when the patient prevents a blood clot, they prevent death, because basically death usually happens after abdominoplasty. from a pulmonary embolism, a blood clot. And thanks to God, we never had anybody die, and we want to keep it this way. What Gabi's doing is she's cooling the area, so this is electrical heat, and that's the way we do it here at the Cosmetic Surgical Center of Cerrito. Thank you. Surprise! We found something. This is your belly button. This is the stalk of the belly button right here. Right around noon, at around 12 on the clock, there is an opening and some fat has come out. We could either cut it or retract it. I'm gonna retract it back into the abdominal cavity, and then we're gonna close this hole. I'm gonna show you how. There is a hole here and the clamp is gonna go in, see? You see? So we're gonna close that abnormal hole that happened when she was born. It's a congenital from birth defect hole in the fascia and intra-abdominal fat. It looks just like that. It's a little more pale. Came out through that abnormal opening. We're gonna close it. Thank you. Okay, so now this is the old proline suture. For those doctors watching out there, we did a figure of 8 old proline closure. So this is an umbilical hernia repair. So we closed the abnormal hole on the base of the stalk of the belly button right there, see? And we repair it, and now we're gonna do what is called the rectus abdominal wall muscle plication. So that's your hernia, and it's no longer coming out into the belly button. Thank you. Wow, do you see that figure of 8? It's like a number 8. Can you see it from there?
Yes.
Okay, so basically this is a figure of 8. All proline is the type of suture, right? We're bringing the edge of the rectus abdominal wall muscles together in the midline where they belong. These are twin muscles that are joined in the middle, and they separate during pregnancy. So we're gonna put them back in the midline where they belong to restore her pre-pregnancy anatomy. And we do this in a completely bloodless manner. And here at the Cosmetic Surgical Center of Cerrito, you know something cool here? This is a deep perforator of the superior epigastric artery, and we're preserving that vessel. So that's important. In other words, I didn't sacrifice it, I didn't cut it. It is preserved in there, and that's nice. We do multiple of these figure 8. Just in case that one of these sutures break, then we have a supporting suture on either side of it. And that's very important. Another technique that is common is that surgeons do a running suture, so it's only one stitch. I prefer this technique because, God forbids, one of these sutures breaks, the entire repair will break if it's a running single suture. But if there's multiple sutures, then supporting suture on either side will basically prevent it from the whole repair being breaking down, right? So that's the way we like to do it. And usually this is a very blood it's a lot of blood loss when surgeons do this, but we do it in a bloodless manner here. And this bloodless technique is very important because it goes beyond what we know, what is commonly known, right? Obviously, if you lose blood, it's not good, right? You get anemic and that sort of thing, the things we mentioned. When there is a blood clot or a blood collection, then that blood can get infected. We know that medically is true. So there's risk of that happening, right? But also there's other things that we don't know as surgeons, and is that basically when we do this, the blood, when it's not inside the blood vessels, it irritates the tissues, and it can create painful nodules, and it can probably predispose also to seromas, which is a complication that we almost never have. Thank you. Okay, so look at the belly button. Looks like a little mushroom. If you come from the top, you'll see. But look how nice, flat, and tight she is now. This is the rectus plication above, go all the way up there, and below the belly button. So we made her nice, flat, and tight. She's not totally flat. She has significant intra-abdominal fat. And when she stands up, that's probably gonna pop out. But she looks really, really good for, you know, the problem that she had. And that's her belly button. We're gonna trim the edge of the belly button and pull it out through new skin, through the hole we made over here. Thank you. So we are done. Thank you very much for watching. She looks absolutely beautiful. We're just gonna put the stir strips. Beautiful umbilicoplasty and a hernia repair. The belly button sinking in nicely. There's no evidence of hernia outside or inside. She looks great. Thank you for watching.